seeing this woman who is in this condition, full-blown AIDS, we gotta talk, people.
5, 4, 3, 2, 1.
Because silence is death, what some never knew. Let's go. The main topic. Let's get into it.
This will be the last time that we stand. I don't know how long we've been here, but
Yeah, I got here probably about 20 minutes before you.
ready? One, two, three. Push through those legs. Come on, push, 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 push. Stand up, stand up, stand up. Push through those legs. Come on, do it. Push those legs. Anyway, not bad.
Not bad at all.
Yo. I'm sorry. This breaks my heart. Because this is full-blown AIDS. This is the end result of being infected with HIV for 8 to 10 years. She has been carrying this virus for 8 to 10 years unknowingly. And because it was untreated for 8 to 10 years, she is in this condition. Let's look at it again, okay? I want you to pay attention. Look at what she's wearing. Look at what she's wearing. Look at her legs.
Legs. Come on, push, push, push.
Look at this.
This will be the last time that we stand. I don't know how long we've been here, but
Yeah, I got here probably about 20 minutes before you.
You see these?
ready?
Look at this. Heartbreaking, yo.
One, two, three. Push through those legs. Come on, push, 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 push. Stand up, stand up, stand up.
Wow.
Push through those legs. Come on, do it. Push those legs. Anyway, not bad.
Not bad at all.
Did you hear her and her cry for relief when they forced her to stand up? I want to say forced. When they helped her to stand up, I can't do it. Not to laugh at that situation. But yo, this condition, this AIDS is highly preventable. So that's what the presentation is all about. This is the end result of being infected with HIV. This is an infection that went on between 8 to 10 years, okay? Now listen, let's talk about some stuff. Because there's a lot of people in this world who are positively infected with HIV and they're not talking. They're not going to get tested. They don't know that they're infected, and because of which their bodies are deteriorating to this AIDS condition, okay? I'm going to show you this video on how HIV becomes AIDS. Before I even start this video, we got to make the differentiation here. We got 1, HIV. That's the virus. That is the virus, the human immunodeficiency virus. That's HIV. When you become infected with the virus, HIV, and it's untreated, and it's allowed to progress in your immune system in your body, then you will make it to what you just saw. AIDS. This is AIDS. AIDS is the end result of being infected with HIV. Pay attention. I'm trying to drop some knowledge on y'all, okay? Because listen, like I said, this is highly preventable, highly treatable, highly manageable, but people are not talking. That's why I'm making this video. Let's get into this video.
This year in the United States, 42,000 people will become infected with the virus that causes AIDS. AIDS is an incurable disease that is the end result of infection by the human immunodeficiency virus, or HIV. An individual who contracts HIV may become sick quickly or can live symptom-free for years. HIV and AIDS are not.
Rewind that. Bring that back. Hear what she said? Bring this back. We got to get this. People, we got to get this. We can do better. We can do much better than what we're doing right now. Bring that back.
Become sick quickly or can live symptom-free for years.
Can become sick quickly or live symptom-free for years, okay? So, in my estimation, I would say that Gena Tew was one of those who lived symptom-free for many years, unknowingly passing HIV to all of those she had slept with without using protection, okay? Allegedly. Some people do not become sick initially, so therefore they go living their lives thinking that they are totally fine and they have unprotected sex with other people, and unknowingly they transfer that virus to someone else. Okay, perhaps, possibly this has happened with Gena Tew, Nick Cannon, Chris Brown, Chief Keef, just to name a few. Okay, so this is why I am making this presentation, to shine some light on how this HIV is transmitted from person to person. Unknowingly, if someone does not know that they are infected and they are sleeping with other people, they could be transmitting this virus. Let's break it back up on here, okay? When HIV becomes AIDS. Let's hear that one more time. People, we got to get this one, okay? We're going to get this one today.
An individual who contracts HIV may become sick quickly or can live symptom-free for years. HIV and AIDS are not one and the same. Those with AIDS are infected with HIV, but people infected with HIV do not necessarily have AIDS. A person has AIDS when their T-cell count falls below a measurement scale of 200, as opposed to the 500 to 1500 in a healthy person. An extremely low CD4 count means that a person's immune system is no longer healthy enough to fight off intruding viruses and bacteria. Signs that HIV...
You hear that? We got to rewind this back. I want y'all to really get this message, people, because we got to do better when it comes to this HIV and AIDS. Bring this back, y'all. Bring this back. We're going to hear this one more time.
An extremely low CD4 count means that a person or can necessarily have AIDS. A person has AIDS when their T-cell count falls below a measurement scale of 200, as opposed to the 500 to 1500 in a healthy person. An extremely low CD4 count means that a person's immune system is no longer healthy enough to fight off intruding viruses and bacteria. Signs that HIV may be turning into AIDS include extreme fatigue, rapid weight loss, persistent diarrhea, a high fever, and swollen glands in the neck.
You see these things here. Extreme fatigue, rapid weight loss, persistent diarrhea, high fever, swollen glands in the neck, armpits, and growing. I want you to notice something here. Did anybody see how tiny that woman was? Rapid weight loss. Okay, that weight loss is attributed to a syndrome called wasting syndrome, which is a hallmark sign of being clinically infected with AIDS. Rapid weight loss, that's called wasting syndrome. Extreme fatigue, persistent diarrhea. Did anybody see her wearing that diaper? She is shitting herself. Persistent diarrhea.
Armpits or groin. Even if a person doesn't have a low CD4 count, they are still classified as having AIDS if they contract any one of 26 opportunistic conditions. Two of these are cancers. One, Kaposi sarcoma, results from a tumor in the blood vessel walls and appears as disfiguring pink or purple lesions on the skin and mouth. Non-Hodgkin's lymphoma originates in the disease-fighting blood cells known as lymphocytes. This appears as swelling of the lymph nodes. Pneumocystis carinii pneumonia is a potentially deadly inflammation of the lungs that is one of the most common infections occurring in people with HIV worldwide. Tuberculosis is the leading opportunistic infection in nations where access to medications is low.
Look here, I want you to pay attention to my man here. I'm going to put his information in the description portion of this video, okay? Because he shares a lot about how he noticed that he was infected with something. Here we go. Let's let my man talk. I'm being quiet.
Thank you so much for tuning in. Today, I will be talking about what my symptoms were when I had HIV AIDS. Now, as I've said in the past, I don't know exactly when I contracted HIV. All I know is that I was diagnosed on my birthday, May 8th of 2012.
Similar, right? Same as Gena Tew. He does not know exactly when he contracted HIV. He just became sickly and was diagnosed on his birthday. Right? Here we go.
Which is 6 years ago this year. So what I can tell you is that I would say about a year to 2 years prior, I slowly started developing more and more symptoms, and those symptoms started becoming more severe. I would say the first symptom that I really started experiencing and noticed was a general sense of lethargy. I just noticed that my energy overall throughout the day was declining. I didn't really feel like myself. It was harder and harder for me to get out of bed. I had a hard time getting through work. I was serving at a restaurant, and I just found myself having to drink more coffee or Red Bull or lots of green teas throughout the day, and I kept needing more, and it wasn't the same as having like a caffeine tolerance. I've had that before, and I just noticed that over time, like, nothing was really working, and I just kind of felt a little more dull. My energy, my zest for life was kind of dimming, and I felt a little bit more like a zombie, and I wasn't quite sure what that was. I was going to the gym, and I started working out because I thought maybe if I'm exercising, just trying to be more fit overall, that'll help my energy levels. A little bit on the elliptical. I feel like I was really gaining anything. I felt like I was losing muscle mass. I didn't feel like I was really gaining anything, which is kind of weird to me. I also was losing weight, but I attributed that to going to the gym and working out and trying to eat somewhat healthy here and there. It wasn't that great, but I was making some attempt. Also, the next symptom that I noticed was vertigo. This isn't something that I really have experienced that much in my life. Occasionally here and there, if I hadn't been eating, maybe I was low on blood sugar or tired or something like that, but it's usually random and few and far in between. But I was pretty regularly, I would say maybe 3-4 times a week, whether I was sitting, standing, moving around, it didn't really matter, I would suddenly get hit with a wave of vertigo. Everything would start spinning, and I'd lose my balance, dizzy, and that would last for maybe 10-15 minutes. The next general symptom that I noticed was body aches all over. My joints, my muscles, just every part of my body. I attributed that, of course, since I was going to the gym, to working out and being sore from working out and exercising, but in reality, I would be sore in places that I hadn't worked out. But when you have no idea what to expect, and HIV is the last thing on your mind, you rationalize things and you kind of just give explanations of what is the most likely possibility, and then if things don't get worse, it is what it is, and you move.
Can you kind of understand why maybe Gena Tew developed some sort of weird, symptom, body ache, fatigue, loss of appetite, dizziness, and totally brush it off, because she had no idea that she had been infected with HIV way back when she was 17, between 15. I'm gonna give it a 4-year frame here, between 15 and 19, living in New York, right? Yeah, it's easily to try to not think of the worst thing imaginable, which would be HIV in her situation, right? Even his situation or your situation, and totally brush it off and try to dim it down to something less severe, right? But that's why I'm making this presentation, this video, so people can get the warning signs here, right? If you are sleeping around and you're having unprotected sex with multiple people who are unsure of their statuses, come on now, you gotta think of it. Like, It's a real threat. It's a real risk, right? That's why I'm making this video. You have got to be in the know and the aware about your health, right? You have to.
I would say probably about a year out from my diagnosis, I started to notice that I was getting itchy, inflamed bumps on my elbows and on my knees. If I put it under hot water, as a result of having gone through that earlier in life, and again, rationalize it, oh, this is just, something I've dealt with before, and this is just, I'm getting older, and I gotta deal with stupid skin things, and people get psoriasis and stuff like that all the time, so this is probably just something that I gotta deal with. I began to notice weird bumps on my body. Lumps, I should say. I noticed that under here, under my jawline and my chin, there were two big round mounds there, and they felt larger than I thought I remembered, but again, with the rationalizing, I'm just like thinking, maybe I'm just thinking that they're bigger, but they're not really, and maybe I just never noticed it before. I was getting sick, I would say, once every month to 2 months.
Listen, I'm going to interject something here. Notice how he is pointing to these areas here, right? I'm not sure if he mentioned the armpits are growing, but listen, everybody's body has lymph nodes, and these lymph nodes are directly connected to your immune system. And the purpose of a lymph node is to filter out, pathogens and viruses and things that will make you sick in the blood. Your immune system is responsible for keeping you healthy. So when your immune system is becoming enlarged and engorged and whatnot, more than likely you're sick with something. Your body is trying to do its best to filter out that pathogen that is causing you sickness in your body. So this is what he's alluding to here, people. Listen, it's like this is simple. I don't say simple A and P, but this is human physiology. Lymph nodes, okay? Lymph nodes. Just pay attention. Try to pick up this information I'm trying to give you, right? Because I think it's important that people, we learn how to take care of ourselves, be responsible for ourselves, and recognize when something's going wrong. So that way we can, prevent sharing it with other people.
So I assumed that if they were my lymph nodes, then they're probably just been fighting off colds, and that's normal, and it'll go away eventually. And then I started to notice that I had some soreness in my armpits, and I would feel there, and there was like tender spots. And I thought, well, I believe that there are lymph nodes there as well. That's interesting. Maybe my body's just having a hard time. Okay, well, it is what it is. And then I noticed two that I could feel on the base of my neck, on the back, one on each side. I could feel the lymph nodes. And again, I just thought, maybe they've always been there, and maybe I just never noticed it. Just never really paid attention to stuff like that, and now I'm being like hyper aware, so now I'm paranoid. And then the really weird one that really stood out, and I was like, whoa, okay, this is crazy. Behind my ears, there are apparently some lymph nodes right there, because do you remember those like 90s snacks? It's called a bugle, and it looks like a cone. Literally, my lymph nodes back here were so swollen that it felt like bugles sticking out. It came out like a cone, and they were huge. I don't know. I didn't know what to think of it. I thought it was bizarre and strange, but I wasn't necessarily feeling sick. I didn't feel horrible. I didn't have to go to the emergency room. There was nothing pressing, so I just kind of let it slide for a while.
Notice how he keeps rationalizing his weird symptoms. Okay, they're totally out of the ordinary, but he's finding every logistical rationalization to attribute to it, to why his body is having like these weird signs. Okay, people, I just hope that this video right here falls into the right person's lap, and they can listen to it, and they can understand the message I'm trying to convey. You've got to be careful out here. Okay, you have got to be responsible and take care of yourselves.
I mean, of course, nowadays, looking back in retrospect, I'm like, what were you thinking? You should have gone to the doctor immediately. But at the time, I just didn't really think much of it. I'd be like, damn, like, here it is again. I gotta go through this all over again. It would last another week or two. And then this time, it wouldn't go away. It was like 3 weeks, and I still have it. It still hurts, it's still sore. And so my boyfriend at the time, his dad had access to medicine, and he's like, let me hit him up in another state and send over a prescription for you to take antibiotics. So I take antibiotics, it works, boom, gone, great, awesome, I can move on with my life. Nope. A couple weeks later, comes right back. So I think this happened for maybe 3-4 times, and then I was like, okay, whoa, it's been 2-3 months of this, it's not going away, I need to go to a doctor. And the doctor immediately was like, let's do a swab of your back of your throat, make sure it's not, some sort of STD. I came back a week later, that's when I found out I had HIV. I came back a week after that on my birthday, and that's when I found out I had AIDS.
Yeah, my dude here. I will link all this information in the description section of this video. But what he has to share, it is golden, right? And I hope that you can listen to his video, at home on your own free time, right? And you can have a different interpretation of what it is he's trying to share about his HIV and AIDS experience. Because I'm just one person here trying to, transfer the information to you watching this video. Yeah, wake up call, right? He has a wonderful testimony, right? Let's go.
HIV test accuracy after 6 months. Hello, Mark Medical's here to teach you everything about HIV infection, including HIV treatment. Today, let us talk about HIV test accuracy. Here are the 7 top points for you. 1. There is absolutely no HIV test that will give you 100% accuracy at any given time, because any test can be affected by things like the HIV window period, our different bodies, user errors, and other things.
Notice that. Window period. The HIV window period. Okay, and I'm hoping that in here you will see why. If in this video, I'm hoping you can understand why. If you have unprotected sex with somebody on Monday, August 1st, you cannot go to the doctor on Tuesday, August 2nd, and figure out whether if you are or not, positively infected with HIV. Let's play.
2. Do not always do one test. Mark Medicals recommend at least 2 or more tests to be around 100% sure of your test. 3. The maximum HIV window period is from 3 to 6 months for rapid HIV tests.
3 to 6 months, okay? 3 to 6 months, remember that.
And up to 3 months for HIV RNA and 4th generation HIV tests.
And up to 3 months for that other test he had mentioned. Yeah, I'm gonna put this video in the description box. You watch it on your own volition, and I hope that you can understand the information he's trying to share with you. I'm just trying to put it out there. We got to give this into the conversation, into the discussion. We have got to be responsible people and take better care of ourselves, because we need to prevent AIDS. Okay, we can prevent AIDS if we know what the hell we're doing. We can prevent it.
4. Any test after 3 months is conclusive, especially if you did not use rapid, antibody-only tests. 5. HIV test accuracy after 6 months is conclusive or 100% accurate. If you test negative between 3 to 6 months, do not repeat the test unless you had other additional exposures. 6. If you test HIV negative but still have symptoms, that is basically HIV phobia.
Meet Patient X, a 21-year-old male who is currently sexually active. Patient X visits his family doctor to inquire about preventative measures against contracting HIV. His doctor tells him about several different protective methods, one of which is a newly designed HIV-1 prevention pill. To learn more about this drug, Patient X visits the Demystifying Medicine channel. HIV, also known as the human immunodeficiency virus, is a virus that targets the immune system, leaving room for infections to take place. Currently, there is no cure for HIV once an infection is established.
Remember that. No cure. Listen, I know Dr. Sebi came on the scene and he's talking all this bullshit about how he has cured such and such person or persons of being infected with HIV and AIDS. Bullshit. It's all bullshit. There is no cure for HIV and AIDS. Bullshit. I'm sorry. I gotta put it out there. Dr. Sebi is a fucking fraud. Sorry, Dr. Sebi, rest in peace. God bless the dead. You're a liar. You were a liar. Sorry.
However, HIV can be treated and managed to prevent the manifestation of AIDS, which eventually degrades the immune system to a point where any infection can be fatal.
Let's go back to that. Bring that back, baby. What did you say again? Bring it back.
And managed to prevent the manifestation of
It can be treated and managed to prevent the manifestation of AIDS. That means that if you have HIV, it does not have to progress to AIDS. Gena Tew condition could have been avoided, but some people never knew. This is what she never knew. This is what some people never knew.
Of AIDS, which eventually degrades the immune system to a point where any infection can be fatal. Since there is no cure for HIV, the best way of slowing down the AIDS epidemic is through prevention and awareness.
Prevention and awareness. This is the message I'm trying to convey in this video. Prevention. We have to learn ways to prevent this thing, right? Prevent HIV infection right off the bat, okay? If we can prevent that, then, AIDS wouldn't even be here. The number one thing we have to do is prevent HIV infection. And the best way of doing that I'm thinking, and the scientists are all agreeing on, is that awareness is the tool. Awareness, okay? Awareness. Because if you're aware of something, then you can avoid it. Imagine that you're driving down the road and there's a big pothole in front of you, right? And you can't see it. So if you're driving and in your lack of awareness, you drive right into that pothole, you're going to bust your tire, crack your rims, damage your vehicle beyond repair. If you are aware, then you can go around that pothole or, choose a whole different path altogether. It's all about prevention and awareness, okay? Because if you are aware, then you are informed well enough to prevent.
One of the most promising strategies in preventing HIV-1 infections is pre-exposure prophylaxis, or PrEP. PrEP is an antiretroviral medication that targets the step in the HIV replication cycle where the virus transcribes its RNA into double-stranded DNA.
Get this. So this protocol, this method here, PrEP, is it targets HIV before HIV can enter your body and replicate its genome inside your DNA. I know I'm getting very fancy in these terms I'm using here, but like I said, go back and watch these videos. Do your own diligence. I'm trying to share some life-changing information here. This PrEP, post-exposure prophylaxis, right? This will stop HIV from binding to your cells in case you do contract HIV. Think of it this way. You're out and you're having sex with somebody. This person here, can you see? This person here is HIV positive, but they don't know it. But you come along and you do. This person has HIV, you do not. But y'all still have sex or whatnot. Let's say that this person gives HIV to you. And let's say that you were aware, okay, that there is the risk out there of contracting HIV, whatever. You are now informed enough to go to a doctor or a hospital or somewhere, and you can ask them for this PrEP, this post-exposure prophylaxis. If you get this medication, it will stop this HIV from binding into your body. Make sense? Makes sense. I hope that makes sense. I try to give you my most easily digested analogy imaginable, okay? Let's go.
DNA. PrEP should be taken as a
I'm
preventative
going to
measure.
that just a little bit. I want you to hear from her again.
PrEP is an antiretroviral medication that targets the step in the HIV replication cycle where the virus transcribes its RNA into double-stranded DNA. PrEP should be taken as a preventative measure and is administered using oral pills or topical vaginal gel formulations.
Boom, we can stop it there. Do you hear that? You can take a pill, I just mentioned here. Story from my past, I've had to use this before. I had I had sex with someone and it wasn't really unprotected. What happened was that the condom had broken. The condom broke during sex, right? And I've always been very worried and concerned about contracting HIV. So I went to the hospital and I demanded that they give me this PrEP that we're talking about in this video. And I have to say that this has been around 12 years now, and I am still HIV negative. So did the medication work? Undoubtedly, yes. And also, that person may have been HIV negative, but I didn't know. But I wasn't taking the risk, okay? Here we go. Because I know that person was very sexually active, right? So yeah, I'm not taking that risk. I want to end this video here with preventative measures for contracting HIV. Number one, the most popular is condoms, right? Condoms. Everybody, if you're having promiscuous sex with multiple people, there is risk of contracting HIV, and other STDs, right? Condoms, they save your life, okay? PrEP, we just mentioned. Testing, okay? HIV testing, you gotta get tested, and the treatment. Let's say that you do come back with a HIV positive test, treat it, because we want to prevent AIDS, okay? It's hard to even say that. We want to prevent AIDS. In AIDS prevention, we should be targeting HIV. Let's prevent HIV. Because if you can prevent HIV, AIDS ain't even on the table no more, okay? So yeah, so people, this is the end of this presentation, and this is what they never knew. If you enjoyed this video and you like this content, please like, subscribe, share. Okay, share this content with anybody that you see, anybody that you're concerned about, because people, we gotta work together. We can prevent AIDS, and the first thing we must do is start talking. It's through talking and sharing our experiences that people get the information that will allow them to be aware, okay? Yeah, so that's that. Like, subscribe, share. Yeah, this has been your boy, CAC, and you are in the spotlight with your boy as we look at AIDS and HIV, okay? I'm out of here. Peace.